great way to show how pressures inside the abdomen influence pelvic floor health. The top of the ball is the diaphragm, right under the rib cage. The abs are in the middle, and the pelvic floor muscles are down below inside the pelvis. When we use our breath correctly, with inhalation, the diaphragm comes down, increasing pressure in the abdomen and causing the pelvic floor to relax and stretch. When we exhale, the abdomen comes up and in, and the pelvic floor contracts and lifts. The diaphragm acts like a piston, and the pelvic floor, when healthy, oscillates between contracted and relaxed. But many of us have faulty breathing patterns. We might stabilize the core during movement by holding our breath. When we hold our breath, you can feel that increased pressure inside the abdomen, which puts the pelvic floor under constant tension. If you aren't a breath holder, you may be someone who is always holding your abdomen tight. This is either to help the abdomen stay flat or to have better posture. In either case, the abs are overtrained. Look what's happening to the diaphragm and the pelvic floor when I squeeze in the middle. The diaphragm can't come down against the pressure inside the abdomen, so we can't set up our recoiling piston. And then look at what's going on in the pelvic floor. Not only is it not getting that up and down opportunity, if it's weakened, it will be overwhelmed from the pressure above. This scenario could contribute to incontinence as well as a host of aches and pains. Here's another faulty pattern. Lots of us tend to engage the upper abs, which shoots pressure, watch this, out through the lower abs and creates the appearance of a little paunch that we hate. We might think we need to lose 5 pounds, but actually it's just poorly managed pressure. Often, the pelvic floor will fight against that pressure from above by staying contracted. This hypervigilance might seem like a good idea, but constant contraction of the pelvic floor doesn't work. Like many in Boulder, those of us who are very fit are often overtraining abs, and it can experience pelvic pain, constipation, and painful sex as a result. In all these situations, constant abdominal pressure does not allow for the healthy and responsive pelvic floor. It's the coordinated interaction of all these muscles that makes our pressure system work optimally.